New Zealand has one of the best records in the world for the way it has dealt with the coronavirus pandemic. Per million in the population, 614 people in the UK have died of the virus. In New Zealand, the number is 4. Many people here in the UK say we should have acted as quickly as they did and in a similar fashion. Well, today, our own Tim Johns has been looking at how Britain has done everything New Zealand did, but in reverse, the wrong way round.
If only there had been one of these. An instruction manual, a guide, a step-by-step handbook on how to deal with the coronavirus pandemic. Although this book didn't exist, it was as if New Zealand had been fortunate enough to see a copy of it. And they followed this how to deal with the coronavirus pandemic handbook to the letter.
We have always said we would act early, decisively, and go hard. And we will.
New Zealand's Prime Minister Jacinda Ardern had a strategy, and as if she was following the step-by-step instruction manual, less than a month after New Zealand's first confirmed case of Covid-19, she put her country into a very strict lockdown.
All indoor and outdoor events cannot proceed. We are all now preparing as a nation to go into self-isolation.
Immediately, the country closed its borders. A key first step was that any resident returning on a flight had to quarantine themselves. A contact tracing team was set up at the start of the outbreak, and all of this early on meant the spread of the virus was contained. Just a few weeks later, their relatively extreme lockdown measures had led to this.
We moved down to COVID-19 Alert Level 1 from midnight tonight.
A week ago, New Zealand declared itself COVID-free.
We have eliminated transmission of the virus in New Zealand for now.
It's so free of the virus that, as this radio report explains, sport is back on the cards.
A rare sight in a pandemic. People packed in a country pub with a new national rugby competition on the television.
People are back together and having a lovely time.
It's really fun. We get to be out and be ourselves.
Indeed, sport and social gatherings are the final chapter in this step-by-step guide. Back to the UK now, where there were similar scenes of people having a lovely time at sporting events.
We were all very grateful that it was on. We were all delighted to be there. The atmosphere was electric as usual.
The trouble is that these sporting events, such as the Cheltenham Festival, referred to here, took place at the start of our outbreak, not the end.
There's a pleasure here that we're very lucky to have because we've got some very tough times up ahead.
Well, it's a good job he enjoyed that horse racing event in March, attended by 250,000 people, because tough times did indeed lie ahead. As it turns out, at the time the virus was spreading like wildfire. It was as if that step-by-step coronavirus handbook, which New Zealand had used to such great effect, was being read in the UK too. But unfortunately, it was mistakenly being read back to front. It was as if someone was accidentally reading it in reverse. From football to horse racing to stadium gigs, as the virus took hold, our first step was a number of mass gatherings. Eventually, of course, the UK did lock down.
I urge you, at this moment of national emergency, to stay at home, protect our NHS and save lives.
And weeks later, the virus finally peaked. As the numbers lowered, the person reading the instruction manual turned to what should have been the opening chapter, but they still had the book upside down.
Today, we formally launch NHS Test and Trace.
What New Zealand put in place at the start, we launched at the end of May. And then 1 week ago, the same time that New Zealand declared itself COVID-free, we implemented quarantine for those flying into the country. Now, in truth, it's not entirely fair to compare these two nations, not least because New Zealand has fewer people, a lower population density, and crucially had more time to prepare before COVID reached its shores. That said, while New Zealand started with quarantine and finished with mass sporting events, the UK started with mass sporting events and finished with quarantine. New Zealand has recorded 22 deaths from COVID-19. Perhaps we don't need reminding of the number in the UK.
No, indeed not. That is Tim Johns reporting on Twitter. He is at Tim on Cheese. Let us go to New Zealand. Let's talk to Michael Baker, Professor of Public Health at the University of Otago in Wellington. We're just reflecting on this. We've done it all the same as you, but in reverse, Michael.
Yes, greetings. Well, certainly it sounds like it. And one of the things that we learned very early on was to look to Asia and treat this more like a SARS virus and less like influenza, because the standard book for or pandemic plan that most Western countries have is that kind of mitigation approach you're describing, where you gradually increase your controls as the pandemic gets worse and you try and flatten the curve. And we actually realised that would have been a disaster And so we took this elimination approach right at the beginning. And as you've heard, we threw everything at the virus to basically extinguish it.
And I know you were one of those advising the New Zealand government on their COVID-19 response, which is now seen as one of the best in the world. We didn't go in hard, because we're only now starting to talk about having to wear masks on public transport. That's June, and this all started in February. So what's the difference between the flu approach and the SARS approach?
Well, the trouble with the flu is you can't eliminate it. You can't do contact tracing because it's so infectious, and it also has a very short incubation period. So with a wave of the flu, it comes through quite quickly, and you can dampen it down, but you can't really stop it. But COVID is a much more slow-moving wave, and you can actually stop it, as we've discovered. I mean, it still takes a lot of effort, and in New Zealand, the whole country was effectively put into home quarantine for 4 weeks, and then a slightly lighter version for another 2 weeks. And then we've cautiously come out of it into a virus-free country. But of course, we also used that time to really greatly increase the level of testing, which was very low at the beginning, and also get all our contact tracing working.
We seemed in Britain not to have the testing capability at all at the start. But also, strangely, we had a go at contact tracing and then just gave up. And we've only now decided to try again.
Yeah, I mean, one of the things is with flu is you have to give up on the contact tracing quite early on because you just can't keep up. But SARS a SARS-like virus is very different. You still have to go very quickly, but you can actually interrupt all these chains of transmission. And that's what you have to do if you're doing the elimination approach. You really are after every last case. But the great thing is when you come out of it, you've got no more virus to worry about. So basically, it's life as usual, and you can also get business going again, just as they've done in most of China and in Taiwan and a number of other Asian countries.
We had a run-up to lockdown where all kinds of things were going on. Cheltenham Festival was mentioned in Tim Johns' piece there, but we had a massive stereophonics concert in Cardiff. There was an international dog show, Crufts, you'll know of. There were all kinds of other things that happened that brought a lot of people together, and we now realise they were part of this.
That's right. I mean, I guess the question is now, I mean, you have got your numbers down to a lower level. It's just a question of whether you go the next step and say, we're actually going to get rid of the virus, because you're managing your borders, you're doing testing and contact tracing, and you could use masks. We actually should have used masks, but we didn't. But in the end, the lockdown was so intense in New Zealand, we actually got through without face masks, but they actually would work well also. I think that's the experience in many countries. So I think you've got all the approaches that you need in place in the UK. If you committed to eliminating the virus, I mean, you're an island just like New Zealand.
Yeah, but I suppose one thing that we have that puts us at a disadvantage is we have got Heathrow Airport, where is a massive terminus for global travel, and it's not even people coming into the country, it's people just passing through.
Yeah, I mean, it would be challenging, and I guess you have to say, what's the alternative? And unfortunately for quite a bit of Europe and North America, you've got the suppression approach where you're going to go in and out of lockdown until there's a vaccine or antivirals, and that could be months to maybe a couple of years.
Do you think a country the size of the UK can do contact tracing as you did it? The figure I saw was that at the height of the outbreak, there were 213,000 people infected with COVID-19 in one day in the UK.
Yeah, well, that is challenging, but that's why you need the face masks and the lockdown, because that means that many of these chains of transmission, they have nowhere to go, basically, and they just end after a few weeks.
Thank you very much. Fascinating. Michael Baker, who advised the New Zealand government in its much-praised attack on coronavirus, Professor of Public Health at the University of Otago in Wellington. So a good few hours ahead of us here in the UK. Talking about whether New Zealand did it the opposite way round from us. So they start with quarantine and they end with festivals. We started with festivals. We're ending with quarantine, mask wearing and contact tracing. So we've done everything in reverse.